Hello everyone. So today we are going to discuss about sprain, that is injury to the ligament. There is another thing that is strain, that is injury to the muscle or its tendon. So sprain can be classified into a primary degree, secondary degree or the tertiary degree. The primary degree is the one where there is involvement of minimal fibers and there is minimal swelling and a localized tenderness, and there is little functional disability of that joint. The secondary degree of sprain is the one where there is involvement of almost all of the fibers, there is marked swelling and pain, and there is disability of functional disability of the joint. Okay, that is the functional disability to use that limb with sprain. The tertiary degree or the third degree is the one where there is swelling, but in this condition there is minimal pain, contrary to the second degree. Now, pathogenesis behind this is consider this as a part of bone and this as a part of bone, and this is a ligament joining these bones. So, either the substance of the ligament may tear or the insertion of ligament to the bone may avulge out along with a chip of bone, leading to a avulsion fracture. Now, diagnosis of sprain is made by history. A patient typically explains about the kind of injury he had, and it helps in diagnosing the ligament involved in the sprain. The examination involves the stress test. Okay, so stress test is the one that helps in diagnosis of the sprain as well as judging the severity of the sprain. Consider this as our joint, that is the knee joint. This is the femur, lower end of the femur, the tibia and the fibula. Now consider this as the medial collateral ligament, and here we can see, consider this the second degree sprain. So in stress test we apply the pressure. Okay, the ligament in question is put under pressure using this maneuver, that is stress test. So in this case, medial collateral ligament sprain, we will apply a lateral pressure to put stress on this ligament. In the case of primary and secondary degree of sprain, the pain will increase, and in tertiary degree there will be increase in joint space. The investigation are generally not done, but when we do an x-ray we do see an avulsion fracture, or or sometimes in there is a third degree of sprain, the joint space will be increased. Rarely MRI and arthroscopy is required in the case of sprain. The treatment includes the famous RICE, that is rest, ice packs, compression and elevation to decrease the edema. The analgesics and anti-inflammatory are given in accordance to the patient, and the plaster cast is done in the cases of secondary and tertiary sprain. Contrary to the earlier beliefs where the plaster cast was used for around 4 to 6 weeks, now we use it for 1 to 2 weeks, and then we give patient the we remove the plaster cast, and we remove the immobilization. This will help in the healing process of the ligament. Okay, so this is what we needed to know about sprain. Thanks for watching.